When I'm treating patients with soft tissue sarcoma, I tell them to focus on the task at hand. And so if it's to get through surgery and recover, focus on that. If it's to get through radiation, focus on that. Don't think too far ahead, and after the treatment's done, we get you back to a normal life. After the diagnosis of a soft tissue sarcoma is made, the next step is to perform imaging both of the tumor site and of the rest of the body to understand where there is or isn't disease. Typically, patients may get an MRI of the anatomical site where the sarcoma arose, followed by a PET scan, which is where a radioactive tracer is given to look for other cancer cells that may be lingering in the body. Additionally, sometimes patients get a CT scan of the chest to make sure that there's no cancer in the lungs. So in general, soft tissue sarcomas are managed surgically, meaning that the whole tumor is excised. Sometimes preceding surgery, radiation is administered, or following surgery, radiation could also be administered as well. The surgery is meant to remove the mass that the surgeon could see, both with their eyes and on imaging. Radiation is intended to eradicate microscopic disease that may be left behind that the surgeon can't see with his or her eye, or that can't be picked up on a scan. In general, patients don't receive chemotherapy as part of their upfront care in soft tissue sarcoma. However, each patient is evaluated individually, and the risks and benefits of treatment of chemotherapy are usually made. Targeted therapy refers to more biologically targeted therapy where we're trying to understand certain genetic markers or certain proteins expressed on a cancer and targeting them specifically. And there's a big research push to understand which agents may offer benefit in soft tissue sarcoma. Immunotherapy is a class of therapy that uses the immune system to attack cancer. There's a great deal of interest in looking at the role the immune system plays, allowing sarcoma to develop or using it to attack the sarcoma cells. So I think the first step is the surgical opinion, and I think there it's important to ask the question whether or not radiation should be given before or after surgery. I think it's also important to understand if the tumor could be taken out entirely, because that is the goal of surgery. So I would ask your doctor, what subclass of soft tissue sarcoma do I have? Because in the future, we may have targeted therapies for certain types of sarcoma, and they also may be monitored and treated slightly differently. This is a curable cancer. It's important to see specialists related to soft tissue sarcoma and to focus on the treatment that you have to do at the moment, and whether that's get through surgery and recover or get through radiation. And our hope is that you'll have a great outcome long term.